Welcome to the Hospital Pharmacy Residency Rotation at the BC Drug and Poison Information Centre. This presentation serves as an introduction to DPIC and the systematic approach to drug information. You will have the opportunity to apply the concepts discussed here during the drug information component of the DPIC rotation. By the end of this presentation, you should have an appreciation for the role that providing drug information plays in pharmacy practice and understand the components of a systematic approach to answering drug information queries. So what is drug information? By definition, it is information printed in a reference or verbalized by an individual that pertains to drugs. Put simply, it's communication about medication. As early as 78 AD, Greek physicians wrote about belladonna and 600 other medicinal plants. In North America, early explorers wrote about the use of medicinal plants by native Indians. In 1962, the University of Kentucky Medical Center developed the first drug information center operated by pharmacists that provided selective, comprehensive drug information for physicians, dentists, and nurses. It was also involved in the education of health professional students, particularly pharmacy students, to develop their role as drug consultants. Today, drug or medication information providers include not only pharmacists, but physicians, nurses, medical researchers, and other healthcare professionals. Providing medication information is among the most fundamental responsibilities of pharmacists. From counseling a patient in a community pharmacy to determining cost-effective medication selection and use of a hospital formulary, to answering medication-related questions as a BC Nurseline pharmacist, the opportunities are continually developing and expanding with changes to the healthcare system. Sometimes drug information that is available to the public and healthcare professionals is clouded by misleading information from news media hype, biased or wrong information, incomplete research, and the internet. The aim is to improve the level of patient care by ensuring safe and effective use of medicines. Effective DI providers recognize the most appropriate resources to consult in a clinical situation and how to apply them. Effective DI providers have the most current and accurate information at their disposal. So how do you approach answering drug information questions? At DPIC, we use a systematic approach. First developed by Watanabe in 1975, the systematic approach involved 5 levels. The first is classification of a request, for example, a pregnancy question or a therapeutic question. The second is background information. What information about the patient is needed to answer the question? The third is a systematic search, a search for the answer in a systematic fashion. The fourth is the response, which is the answer, which can either be written or verbal. And the fifth is reclassification of the question if necessary. In 1987, this was further refined into 7 steps. Revision was necessary due to the growth of information technology, one of the most rapidly growing technologies in healthcare. Not only do you need to keep up to date with medical use concepts, you need to keep abreast of the developments in information technology. The modified approach includes the following. The first is to obtain demographics of the requester, that is, who is asking. The second is to obtain background information. The third is to determine and categorize the question and possibly reformulate the question. The fourth is to develop a strategy for a search. Databases require a certain skill to search. The fifth is to evaluate, analyze, and synthesize the information or studies found. The sixth is to formulate the response, and the seventh is to conduct a follow-up and documentation of the question. Like this picture, one can look at the systematic approach to drug information as being a temple built from a clinical problem or question. A systematic approach to a question provides a consistent starting point to build upon, even if the subject isn't part of your expertise. It also serves as a checklist. By following each step in order, you are less likely to miss potentially important pieces of information. Similarly, it may save time by preventing you from repeating some steps and going in circles trying to generate a response. Finally, if done correctly, the systematic approach ensures a consistent professional end product, such as a clinical recommendation that further promotes the drug information provider, usually the pharmacist, as an invaluable member of the healthcare team. What happens if you don't follow the systematic approach? an incomplete and possibly wrong response to the question. To start at the beginning, the first step in the systematic approach is to confirm the demographics of the requester. Determining their position and training provides insight into their knowledge regarding the subject matter and affects the detail of your research or response. Given the same inquiry, the response and level of detail provided to a specialist may be much different than that which you would give to a general practitioner. Would you give the same amount of background pharmacology to a nurse as you would another pharmacist asking a question? Demographic information should also include confirming a means of contacting the requester, be it by phone, fax, email, or in person. Obtaining background information. Historically, this is the most difficult step for students and practicing pharmacists alike. The types of questions to ask when obtaining background information can be broken into 4 distinct categories. Some general information should always be obtained, such as, why are you asking? Does this concern a specific patient, or is it purely academic? What resources have already been consulted? Knowing why one is asking puts the question in context. If a pharmacist is asking whether an interaction exists between moxifloxacin and quinidine because another pharmacist read about it somewhere, your response may be different than if the question stemmed from the fact that a patient went to the emergency department while on this combination. If the time frame with which you have to respond to a question is already short, knowing what resources the requester has consulted already will avoid duplication of work. However, resources that have already been consulted by the requester may not be up to date. It's a good idea to confirm that they are. Even then, the requester may not have the expertise to effectively use a particular resource, such as searching PubMed. You may want to recheck those resources to verify information. Other background questions should be specific for the nature of the request, such as ones related to patient and drug. Please see the attached slide. For identification of a foreign drug, some specific questions may include how the generic or brand name is spelled, or whether an alternative is needed if the drug is not available locally. Lastly, you should always provide the requester an opportunity to add any additional background information not obtained through the previous questioning. A requester's clinical experience with the subject matter may provide invaluable information that could save the responder time spent researching an unfamiliar topic. If, after having asked all the previous questions, you can answer the question, why is the requester asking for this information, then adequate background information has been obtained. The need for obtaining a sufficiently complete background often conflicts with the limited amount of time a requester has to spend answering questions. An impatient requester may hinder a productive exchange of information. In that case, briefly try to explain the importance of an adequate background while empathizing with the requester regarding the lack of time. Suggest a callback when more time is available if the question is not of an urgent nature. Often the requester may be an intermediary, so they do not know the entire reason behind the question. For example, a physician asks a pharmacist a question who in turn contacts the DI center. In this case, the intermediary pharmacist may not have sufficient information to answer background questions. More information may be required from the physician, either